Well, good afternoon, everyone, and thank you so much for joining us today. My name is Michelle Mabry, and I'm a clinical supervisor with Nutritious Lifestyles. Speaking for you today is Janet McKee, the president and owner of Nutritious Lifestyles, which is a group of 180 dietitians, chefs, and CDMs that provide nutrition and food service consultations nationally. Janet specializes in adult and geriatric nutrition, nutrition for renal disease and pressure ulcers, and speaks nationally on nutrition for the healthcare and food industries. She is a board-certified specialist in geriatric nutrition, as well as a diplomat with the American Professional Wound Care Association. Janet has important updates to share with us today to help keep everyone safe during these challenging times. So without further ado, I'm going to turn the stage over to you, Janet.
Thank you. So I know that a lot of emphasis has been placed on skilled nursing facilities with COVID and behavioral. So I wanted to give us an opportunity to educate our behavioral facilities that they also have COVID positive residents and staff. And so I wanted to provide some information to them. So I appreciate the opportunity to provide an educational opportunity. So we really want to focus on keeping all of us safe, especially patients. But we also know that it's so important for behavioral patients. They value food and dining services very, very much. So we want to make sure we provide them the quality that they need and want. So our goal is to keep the patients, the clients, and us all healthy. I just am listening to a lot of information regarding the COVID vaccine for a number of reasons, but mainly because I want to get my life back to normal, as many of you certainly do. I received information yesterday on one of the radio podcasts that I listened to that the director of the CDC has announced that he projects the United States would clearly have a viable vaccine available for utilization in November or December, but he is expecting it to take from that period 6 to 9 months to provide that to the community. So COVID is here for a long time, so we're going to need to learn to work with it. And we do care about our clients and our patients, so we want you to be safe because COVID has a lot of negative effects. It definitely promotes weight loss. So our objectives today is keep our kitchens clean and keep our staff safe, avoid cross-contamination in the dining areas and staff rooms and also patient areas, and to talk about disinfectants that are cost-effective and sanitizers and the required amount of support and time that they need to be in contact with said materials, and how do we implement these procedures to serve quality food and we still have kitchens to run. And there may be, we just don't know, there may be times in the fall that there will be a flu issue. People will have to stay inside, and because of, especially in the snow-driven areas, there may be a lot of closed areas that people are very close together. So social distancing may be very challenging. We already see that school is starting back. My son's school has already had, I believe, the 4th case came through, and it's a very small school compared to colleges. Our neighbors have, their daughters are both positive COVID, or college students. So again, we need to keep safe. So in my case, I can tell you that I can attest to this myself. COVID is a flu for healthy young people for the most part. Teens and kids can be carriers and you don't know it. My son is 17 years old. He had COVID, not once positive test, but twice. Interestingly enough, he tested negative for the antibody test, which is quite interesting because I assumed that you always had to have a positive antibody response to any virus or bacterial infection, flu, etc. However, that child was forced to stay in his room 14 days on paper plates, and he never had one single symptom. Unfortunately, we didn't know if he was truly positive or false positive, and so we kept him isolated in his room. None of us got COVID, and none of us ever did test positive. So we were tested multiple times as a family. So again, he clearly was just a carrier because he was completely asymptomatic. So many healthcare workers are young, as we know. Many of our CNAs could be 20 years old, and our techs, they may be carriers and not even know it. Now, we are doing testing guidelines for different industries. For example, in certain facilities we have in Texas, they're testing once a week. In other facilities, it's every other week. And so in our behavioral facilities, it's state to state, but many of them are testing at the door for febrile conditions and also the questionnaire. So it's important to wear personal safety equipment, personal masks and gloves, and check temperatures to avoid infection, bringing that disease into vulnerable populations, especially our behavioral facilities that have geriatric units. I just listened to a wonderful presentation by Mary Linford on laboratory analysis for nutritional diagnostics, and her research and the studies have recently shown those that have micronutrient deficiency, especially vitamin D, are very prone to getting the virus. So the more we know about this virus and nutrition, the more we know we need to know. What are the facts? Well, as of August, we had almost 5 million people that had this disease. We had over 157,000 deaths, and more have been reported. The good thing is it's less than 1% fatality rate. Unfortunately, sick people, our behavioral people, could have diabetes, they could have cardiovascular disease, and lung, especially the elderly, are prone to have negative outcomes if they get COVID positive. So again, our focus is to keep our employees and staff and our patients and clients healthy and safe. So we know that COVID is definitely spread through the air and through respiratory secretions. So again, wearing the mask, using hand sanitation is key. We used to be really concerned about it touching plastic, but recent research has indicated that it clearly doesn't live long on plastics, but we still need to wipe them down and be very careful. So we know that they can live, but we know they thrive getting from contact to contact, nose to mouth. We also know now that it is possible to get corona through the eye area. So the cells that are around the eyelid are very prone. They're very vascular. And so it's an easy into the bloodstream. So many of our facilities have requested that we wear goggles completely covering the eyes. So you may not have symptoms if you're positive for 2 to 14 days after exposure. In fact, you may never have symptoms at all. But the typical symptoms are shortness of breath, fever, and cough, and we have no idea why some people end up with fatality, and we really just don't know why some people get so sick and others don't. We do know that if you have comorbidities, that it really increases the risk of getting the virus and having a negative outcome. Anybody that has immune compromised status is in danger. We know at this time that there is no evidence that COVID-19 goes through food, but still sanitation is key. We're waiting a vaccine. We've already discussed this, and different people say different things. I know it's being tested. Reportedly, I had a client tell me yesterday that her son is in the military in California, and his group is at the pilot site. So again, to avoid COVID infections in our patients and our staff is staying healthy and keep our immunity strong. Anybody that loses even 3% of their body weight is a target for COVID infection. So what can we do? Well, we definitely need to make sure we have policies and people follow them. If you're supposed to wear a mask, you wear a mask. A building was recently cited through Joint Commission because the person's mask came down, they touched it with their hand, touched their nose, shoveled it back over their nose, then they went back and touched something else, a piece of equipment. they were cited for cross-contamination. So be aware the Joint Commission is going to be looking heavily at sanitation control. So make sure you're following your CMS and your state guidelines and the Centers for Disease Control. Everything in this realm, which is so new to us, changes a lot. So check the websites frequently. Attend webinars like you're doing today to get information. Be proactive, not reactive. Look outside the box and see what we can do differently to keep our people safe. So we know that hand washing, if you sneeze, if you touch a piece of plastic, someone just excreted a saliva content on, it's called COVID positive, that's a pass rate. Touching your nose, the nose is a portal for this disease and mouth. So it's important to keep your mouth and nose covered if you sneeze and deposit that. Stay away from work and anywhere else if you're not feeling well. And we will go over this in great detail, but it's important to sanitize the kitchen and disinfect it outside areas where there's a lot of patient contact. Keep your social distance. For right now, hugs are taboo and waves are in. So again, you may need to get a mask. If you buy a cloth mask, many of them can be washed in the washing machine, and you can use Lysol as a sanitizer, liquid Lysol, soaking them in that and then washing them works. And again, if you are like these college students that just tested positive, these two young ladies, both of them were doing sorority rush, and so there was certainly no social distancing, and they did not wear masks, and they were getting ready to spread the virus down to Key West, but luckily the school called them and returned them back to campus. So again, as managers, inspect, don't expect. The front of the house and the back of the house should be COVID-free. Well, we definitely want to make sure that we use the appropriate sanitizer. So for the front of the house, we should use a disinfectant that kills the virus. For the back of the house, using a sanitizing agent that kills the majority of the germs is appropriate. So we need to sanitize the back of the house, and I'm going to go over some ways that you might do that. But this is what your kitchen wants to look like. You want to make sure that people are not touching food manually, they have gloves on, etc. Now, here are your acceptable sanitizers. Quat, 200 to 400 parts per million, and chlorine, 50 to 100 parts per million. And a very inexpensive way to make that is using a gallon of bleach, chlorine-based bleach, to a gallon of water. Ammonia quat is not a disinfectant. It is a sanitizer. It does not kill 100% of those viral germs. So it's really, really important that patients, areas that have a lot of hand contact and sneezing contact, they need to be disinfected every 2 hours if they're used all the time, and after each meal period has closed. So disinfect. Again, you want to have your areas clean. You want to make sure they're disinfected, and remember that disinfectant, do not wipe it down with a towel to dry it, it air dries. So here's what we need to worry about: your break rooms, your tables, your dining room chairs, your carts, your doors, your phones, all those things that have a lot of contact with human beings. Air dry, because once you use a towel, you're sometimes spreading germs, maybe not COVID germs, but other germs, and it's just not sanitary. In our dining rooms, again, we want to try to do social distancing as much as possible, and depending on your setting, if it's an acute behavioral, you certainly want to have pathways that your cognitive residents that come to the dining room and go through the tray area and the line are socially distancing. You want to print out traffic flow patterns. You want to make sure that they're 6 feet apart. And when people sit together, if you don't have the facilities to do complete social distancing of 6 feet, then we're going to have to look at something else and possibly using a plexiglass divider to keep people apart if you don't have the space. An RTC that's 60 beds might not have the space and the time and the allocations to do the 6 feet apart. So your chlorine base, which is very inexpensive because at one time we simply were not able to get sanitizing agents and disinfectant, and that's better now. But the rule of thumb for chlorine based are 50 to 100 parts per million for a sanitizer, and 1/3 to 1 gallon equals 1,000 parts per million. That is considered a chloride-based disinfectant, and it will bleach. So it's important that when you're disinfecting with that 1,000 parts per million for this particular type of disinfecting agent, that you dip it for 6 minutes and that it has to be on contact and you allow it to air dry. There are many different kinds of disinfectants in the world, and here's a source where you might look at getting some of those from. There may be staffing shortages in the future, and there may be equipment shortages and delivery shortages. I have been waiting for almost 6 months for a rocking chair that I don't believe is ever going to come. So we need to monitor our employees for sicknesses and send staff home, even if you're short in the kitchen. So you might have to convert to a complete convenience menu, such as spaghetti and meatballs, because it's quick to prepare, versus sliced chicken breast that you have to have pre-ordered the chicken breast and slice yourself. So we need to train our staff to stay healthy at home and healthy at work. So we don't know that the last person that used the gas pump is not corona positive and did not spray sputum or sneezing on that gas handle. So it's better to be safe than sorry. I highly recommend taking alcohol wipes and wiping down everything you touch, because again, we know that it can survive for a brief period of time on materials, and COVID is alive and likes to survive. All viruses mutate and like to survive. This one is mutated. So people have to have time off from work. So encourage them when they leave your office or leave your hospital or RTC to use social distancing, wear their mask, avoid large groups. If you're going on vacation, I just looked at the newspaper the week of Labor Day and I saw Miami Beach was not social distancing. So it's important to be safe during vacation. We don't want to make our residents and patients sick and clients, and we certainly don't want to make our families sick. As we talked about before, our staff can be vehicles to take to our already compromised patients. If you work in a behavioral center and they have a Jerry unit and that person already has COPD, CHF, and diabetes, if they get COVID, there's a much higher probability, especially with cardiovascular disease, that they will have a fatality. Nobody wants that. So we want to keep our staff safe. So if you have COVID positive clients, and some of you actually have multiple COVID positives, so if you have dealings with those individuals as a technician, then it's important that you keep your family safe. So we recommend removing your clothes in the garage or a doorway, wash hot soapy water, a chemical sanitizer, and then hot air. And for a 30-minute dry, and do not wash your clothes with your families. Leave your handbag, your shoes, your briefcase, your backpack, and spray it down with disinfectant. Again, remember that the chlorine, 1,000 parts per million, will bleach everything, and it's already bleached carpets and clothes. So frequent hand washing is essential. You know, there may be in a behavioral geriatric unit that you're assisting feeding. It's important to wear gloves and masks for staff, but also to change those gloves and wash your hands and use a hand sanitizer when necessary in between residents and changing gloves. So again, hand washing is essential. So when you're getting your hand sanitizer, at one time there was a shortage of that too, but now we're pretty much not having to make our own anymore, using aloe and straight alcohol. Is using a hand sanitizer between washes is a really good thing. So if you're on a unit that you're having to help kids eat in a pediatric, geriatric / environment, then it's good to have hand sanitizer in the dining area so you can pump your hands, use gloves appropriately, and help people if they need help eating. So again, you always want to wash your hands and changing gloves, and you definitely want to wear gloves. So it's always a good idea to think about your staff on the general floor unit as inspect, don't expect. So hand washing is a very difficult thing to remember to do. They get busy, etc. So we should inspect, not expect. So one of the things, and remember there's been multiple studies over the years that even with interns that are physicians that were doing internships and residencies, 60% of them did not wash their hands. They did a study that showed anywhere the soap didn't touch, their hands sparkled out with neon lights when the light flashed on them when they came out of the washroom because they did not properly wash their hands. So it's good to inspect hand washing, remind people to do that, and have signs everywhere. Again, washing hands and keeping lethal contents and respiratory contents away from people are key factors to avoid the virus. So we encourage our patients to wash their hands between eating and also to use hand sanitizer. If they just touched a table and someone has sneezed on that that's COVID positive and they put a fork in their mouth and they touch their lips with their fork, they very well may be encouraging an infestation of COVID and not know it. So in many of our food service departments and nursing departments, we have a very high Latino population. In fact, the Latino population is the fastest growing population in the U.S. today. So we need to have bilingual hand washing protocols as a reminder at every sink, the nourishment room, when we're passing graham crackers, when we're giving out snacks, when we're passing foods, in the dining room, in the kitchen, in the bathrooms. Washing hands are key to keeping this virus at bay. COVID if we work together. We definitely do not want our administrators, our social workers, and our nursing staff coming down from the unit that may have a positive COVID individual and sharing that disease process with our staff. The kitchen is made and the dining areas where they're closed with food service or for kitchen staff only. And you need to, in services, if they need something, they can call down or come to the door. They do not need to come in. So as you as a clinician, because I don't really know for sure who's on the call, but if it's a dietitian or a dietary manager, then you should make sure nursing staff that you follow the sanitation, control, and isolation policies. Wash your hands. Use hand sanitizer of 60% alcohol before and after going in a room, in the kitchen, and dining rooms. Patients with COVID, do not, especially if you're a dietary staff, enter that room unless you need to. Look at, if they're on isolation, look at the policy and follow it. Keep those patients' materials separate. Safety to you is first and foremost, as well as to the clients. This is one of our facilities in the Texas market, but they have a large number of COVID positives. And they have done an excellent job of creating a physical barrier, like a holding room. The trays come into where this kind of a plastic-looking cover is. They're dropped off there. The folder goes back. The nurse picks up the set of trays, takes it to the unit, passes it, changes hands and gloves in between pass, and then she takes it back empty with the trays, and then dietary sanitizes it in that barrier room. So that was an excellent idea. I wanted to share that with you. So you're keeping your COVID separate from the rest of your unit. So again, they're using isolation rooms, which I think is a wonderful idea. So staff, when you're on isolation, it's really, really important to make sure that you see that patient, you wear gloves, and you get rid of those gloves and wash your hands and change gloves before seeing another person. So carts and trays that go on the units that see COVID individuals need to be disinfected using that strong disinfectant. If possible, it's always good to use disposable containers. Spray down dishes, and they have to be in contact with a wet solution for 6 minutes, air dry. This particular bleach product will ruin a carpet and they'll have to be replaced. So it's best practices to use disposable if you can. And in a behavioral facility, as you know, it is essential that you count your plastic spoons and knives on the way back up to the kitchen. You can take a fork, shift it around, and make it to a spot to hurt somebody else or themselves. Nursing staff on the units are to deliver trays, typically, especially dependent residents. It's a new day in our behavioral facilities. I would say 20% of our behavioral centers have behavioral units for psychiatric patients that are in a skilled nursing home, and they're completely dependent to help for meals. So that's important. It's important to get rid of all equipment, paper equipment that you're using to assist a COVID resident with meals, and that you dispose of all those disposals in a red bag in the room and get rid of it. So we want to keep the COVID infected materials away from our general population and staff. There were times this past summer that we just were not able to get styrofoam because in the restaurant industry we picked up gangbusters, but not inside dining. Only the outside dining and takeout. So if you're running low on styrofoam, you just would have to use some paper goods and tinfoil to wrap your items. We're hoping that doesn't happen again, but tinfoil can go over a paper plate just as, and it will serve the purpose of keeping the food warm. We will continue to have COVID. Their appetites decline. So it's good to have, they may not, if a COVID resident is in your facility, they may not want lasagna, it's too heavy, they've lost their taste, etc., etc. They might want soup and a sandwich. They might want a simple bowl of macaroni and cheese. But these are foods that are available to them, but put them in individual packages and always have an always available menu. Now, these foods sometimes will be going down with the unit for a positive COVID individual. So if your menu is cream of tomato soup, ham and cheese deli sandwich, diced peaches, chocolate milk, and orange juice that can easily, the soup can go in a styrofoam cup with a lid, the sandwich can go in PC wraps of paper, the diced peaches can go in a PC, not can, but container. You don't want to send a pop-top can that gets left on the unit and somebody cuts herself. Cartons of milk and paper and PCs of orange juice with a pullback, kind of the tinfoil individual serving. Those are ways that you can make the food attractive and look good and send it down to the unit, keep it safe. Now, I have experienced a lot of patients that receive burns because somebody like an MS patient that's elderly, they spill hot coffee, they can't feel it on their thighs. So it's important that for hot foods for dependent diners that we identify that as a problem. Lasagna holds its heat really well. So if you leave the kitchen at 180 and you take it down to the unit and it goes down to 160 and smells on a geriatric, it can burn their skin. Their skin will burn on 60 seconds of something very hot. It'll burn, it can cause second-degree burns. So we need to be careful and assist and careful. So when we're taking food down to a COVID unit, if we're using regular dishes, the dishes have to go off, regular trays on the cart, it goes directly to the resident room, and we dispose of leftovers in their room. We use proper sanitation, proper washing, hand gloves, and again, trays and carts have to be in the sanitizing solution for a minimum of 6 minutes. So we need to make sure that we are getting that message across. So everything that goes in a COVID unit or the end of the hall, you have 3 patients COVID that are COVID positive, needs to stay that unit. Reminder, use disinfectants based on the manufacturer's guidelines. Don't wipe down anything. Everything should be air dried. So the dining room is unfortunately taking the brunt of a lot of things that have occurred with COVID. And the social isolation and the different looking dining rooms has not had a positive intake on our residents' appetites and patience. So when you're in the dining areas, we should be disinfecting things. We should be removing centerpieces because if not, we have to wash them every single 2 hours and after each group comes through. So do not use salt and pepper shakers, use the little tiny salt packages. And you can, if you have a small dining room and you don't have room, consider plexiglass because this is going to be here for another 9 months. All silverware should be individually wrapped and of course accounted for in the dining room. And the floor should be mopped after each meal with a strong disinfecting agent. We don't know the person didn't sneeze and get COVID on the floor, which would then get transferred to your feet. If you put your feet up to fold them over your legs, as many of them do while you're reading, and you touch it, you can put that in your mouth. Again, hands away from the mouth. So how can we have a positive dining room experience, but try to keep our clients safe? Removing menus, because many of our facilities have restaurant-style menus on the tables now, and people touch those. We can try to make the walls look better. We can monitor, we can assist, we can disinfect, and it's essential to have the sneeze guard on the tray line that when you go up and ask for, I want my burger and fries, that is disinfected, and using PCs of food. So patients should be encouraged to use masks if the facility policy mandates that. Here's a policy on how to reduce viral transmissions in limiting the dining room and use of social distancing. If you were to need that, feel free to use it. And this is an extensive policy. Again, when you're using room trays, single service, and if you're using, we don't lean towards salad bars, it's too difficult to keep them sanitary and COVID free. So by using your pieces of juice, especially when you're prepackaged salads and milk in the carton, can help reduce the risk of having COVID. So that's really important. Now, when you're negotiating your food budgets, remember that PCs are more expensive. And that should be something you're able to discuss with your administrative team. So if your dining room's closed and you're delivering food to the units, we've talked about that. But here's a policy that feel free to replicate it and you may use it. And we want to take this opportunity. People are frustrated with COVID. Make sure that they know that we're training and we're providing support for them in service on new policies and support them. Adjust your plan as conditions change. You might have a unit that you have 5 people that are COVID positive. You have to do delivery trays with disposables. We don't know what the future is going to bring, but I know that this COVID has made us have to learn how to change on a dime because we just don't know what we're going to be shorted out of. There was a time we couldn't get beef. There's another time we couldn't get chicken. So again, we have to adapt to a changing environment. Here's a sample in service. Some people still don't understand about COVID, so it's important to educate them. It's important to keep our dining room safe. It's important to keep our residents and clients healthy. We need to give them substitutions. If they have a unit tray, they don't like lasagna, then a soup and sandwich might be good. Using social distancing. In a psychiatric facility, if you have that 2-hour window, it's good to have different meal times set up 30 minutes in back to back from each other to give time to mobilize the patients in and out and to sanitize. So wearing a goggles and mask based on the facility policy for staff, making sure that your staff is using hygiene, not reaching over, touching the patients, following the facility's policy for COVID-19 isolation. And when we send food down on that unit, we need to make sure it's either in a PC or covered to keep that food safe. And if you have people eating on a unit in the community room, it's important before they eat and after they eat to make sure that unit is sanitized, the table sanitized. We should not be leaving the kitchen as dietary staff to avoid cross-contamination. We should not be going down the units feeding people. Nursing and dietary as separate as we can. A lot of times we forget about this, but as you age, dysphagia, which means the inability to swallow succinctly, occurs. It's not good, and it occurs a lot with people that have comorbidities. They may lose weight because they have COPD, and others are fighting for breath, so that sometimes they have to choose to take a bite or breathe. So breathing's going to get it every time. But it's very, very important that we help those clients eat, and they are at choking risk. So it's important to monitor them and make sure they have assistance in eating. Again, spacing tables, monitoring in the room, looking in the room dependent diners. If you have an elderly person that has a room tray on styrofoam, if they have dementia, they can chew the styrofoam and choke. So that's important that you look at that. But it's also important to make sure they indeed like the food and they can eat it and take care of themselves. If they lose weight before or after COVID, the mortality rate goes up significantly. So people need to be able to socialize at meals. This is a very small dining area. They don't have the room or the labor to do 3 dining room settings. So what they did is that they ordered, and there are multiple places you can order that plexiglass dividers so they can have 2 people to a table. It works out that the elderly that sit in this particular facility can talk to each other, but you could use this in any facility. Geriatrics and pediatrics. It allows them to socialize at meals and activities. Social distancing is a must. Again, you have to disinfect that plexiglass. And they're very inexpensive. That one right there, to the right of the slide, that's just one pane. I was told that was only $39, and it's guaranteed for a year. So we will be short of staff, even in light of not having COVID. People call off all the time, and dietary frequently is short of staff to start off with. So you may be short, somebody may call off, and you may need to use convenience foods. You also may need to convert to your emergency menu to use that food up, so you're first in and first out. I just got a tag at a facility because they had some type of, I believe it was black beans or some kind of navy beans, had been left on the shelf for over 2 years in their emergency supply. So let's flip that food out to be cost effective. Make sure that you collaborate with the dietitian on appropriate menu solutions that work for your facility. Cross-train your staff. The cooking that you would do in a facility may be a very convenience-oriented menu, and you may not need a cook. An aide might be able to do that if the cook is sick. So you may need to keep a backup supply of disposable serviceware because there may be shortages in the future. It depends on if COVID becomes a resurgence or not, and we just don't know that information at this time. Educate your staff. It's very, very important to keep people informed. People that are informed are less fearful than those that are not. I can assure you that staff shortages will occur if they're not already occurring. They were really bad in a number of clients, but they will continue to occur, especially with fall and people being closer together. So fortunately, the Pineapple Academy, due to the literally hundreds of thousands of caregivers that are working, but yet their peers in the hotel industry and restaurant industry are not. They are giving free training classes to food service staff that want to work in the healthcare industry. So this is a wonderful opportunity for you to refer a friend or a neighbor that's lost their job so they can get a job in your facility, a behavioral facility, a nursing facility. Healthcare seems like they never have enough staff, and needless to say, many restaurants have closed because they can't make it with 50% occupancy. So we have to adapt. We have to change our menus based on what we can and cannot get based on our labor. You have 2 people out with COVID and you can't hire anybody until the decision is made about when they're coming back, or you don't use a temp agency. Change your menu. Make it where you can be successful in getting out quality food. Here's an example. The original menu called for roasted pork with fresh apple rings, fresh green beans, not frozen but fresh, baked sweet potatoes in the hull, butter biscuits, and iced chocolate cake with whipped topping. An easier menu would be pre-cooked baked turkey breast that is sliced only, frozen green beans, canned mashed sweet potatoes. You can use a marshmallow on top and to fluff them up a little bit, butter biscuits and brownie squares that you're making it by a mix. So you want to educate your team members and let them know that we were changing the menu. And people are empathetic and understand if we have to change the menu because you have 2 call-offs. So we want to alter those menus and not cost. You can alter a menu and not cost your shirt and leg off your budget. So by using seasonal produce is an excellent idea. In March in Florida, strawberries are almost giving them away. I think I saw them $5 for $6 for quarts. So that would certainly be something you could put on your menu. Using canned items like canned sweet potatoes are less laborious and less expensive than fresh sweet potatoes. Using a 90% juice blend or using like a 80% orange juice and a 20% pear juice is less costly than 100% orange juice. Using hydration beverages between meals. We get enough nutrients with 3 meals a day and a snack that we're going to meet our nutrient needs. Use less costly things at the plate if you've had to spend more on certain items because of COVID. For example, a chicken thigh is 30% less than a chicken breast. Egg, meat, starchy casseroles are very expensive. For example, spaghetti pie. That also is a great food to send on the unit in a styrofoam container because the heat retention is excellent. Bean, rice dishes, and bean-based foods are very, very good crowd pleasers and they're comfort foods. People are afraid in all kinds of industries of COVID. We want and demand starches and comfort foods as a society, be a patient or you as a staff member. People are eating more comfort foods. Ditch the salad bars and the dessert bars. Single serve is the way to go to keep COVID at bay. So again, you want to work around providing different foods you may not be able to get. For example, let's say you have fried okra on your menu. Well, you may not be able to get that. So you may end up getting fried okra, getting something other than fried okra. You may have to sub out green beans, or you might have to switch it to another food. But the exchange group should be attached to this. You exchange protein for protein, vegetable for vegetable, and you fruit for fruit and dairy for dairy. Now there is an exchange list that's attached to this presentation. So an ounce of turkey is the nutritional equivalent of an ounce of ham. An ounce of pork is the equivalent to an ounce of turkey. So this is just an example of how you can reduce production and serve a quality meal. Staff call off, use frozen lasagna. Green beans frozen, garlic bread frozen, canned chocolate pudding with chocolate sprinkled and using that canned product. That is a very labor not intensive meal, and therefore it will work quite well for your population. It's always good to inspect and not expect. Daily, you should be walking through the dining hall. This is a daily check-in we use to make sure that our foods are provided, our kitchen is clean, and that our dining rooms are clean. People do what you inspect and never what you expect. I've been managing people for 32 years now, and I truly believe that. And I think it's important to have expectations in writing. So if your staff knows that I'm going to be looking for this on a daily basis, they are more prone to do it. So again, inspecting and not expecting, because you will be very disappointed if you expect people to follow the rules and guidelines, because they won't. So keeping our patients and clients hydrated. That's important to prevent COVID, from pediatrics to adult to geriatrics. Anybody that's lost weight, anybody that's dehydrated is going to be more prone to pick up a COVID virus positive and get very, very sick. Immunity and immunity compromised diseases such as HIV, coronary disease, unfortunately that promotes COVID, and nutrient deficiencies. It promotes people to get COVID. So COVID is an interesting illness. The more we know, the more we don't know. But what we do know is this. We know that COVID affects the olfactory bulbs in about 85% of the people that get it. The olfactory bulbs are the bulbs in your nose that cause you to taste. Many COVID patients, clients, and just people at home that have had COVID do not get their taste for a month post-COVID, which promotes poor food intakes. The food tastes like straw, and they are fatigued. It is a serious virus. I read an article about a woman that was a nurse that got COVID, and it took her 3 to 6 months to get back to where she could even walk a mile. So it's important. And these poor intakes cause the risk of protein calorie deficits, nutrient malnutrition in the micronutrient like your vitamin D, your potassium, etc., vitamin C. And again, this is an acute related type of malnutrition and can promote involuntary weight loss. If you can't taste it, everything tastes like a stack of straw, you're simply not going to want to eat. So for our COVID patients, it's a given that they're most likely going to be at nutritional risk. So what can we do as clinicians? Well, number one, we have to monitor their weights on a weekly basis, monitor their eating and drinking, address their weight losses, and try to prevent their weight losses. If we already know they're only eating 50%, then in a behavioral facility, we might try giving them their 3 meals a day, but also 2 snacks a day. We've got to address that weight loss rapidly and expediently to prevent negative outcomes more so. Evaluate hydration status. I just listened to that lecture on labs, and it was quite interesting. The lower the vitamin D level and the lower the lab's indicative of hydration status, or in other words, the patients are dehydrated, the higher probability they were going to catch COVID. Pushing fluids, monitor for chewing. If you have an 85-year-old woman in your geriatric unit and she's lost 20 pounds related to COVID and comes to your unit, she's going to have difficulty chewing because her dentures may not fit. In addition to that, for every 3% of weight loss you have, it decreases your strength and immunity greatly. So we should be monitoring food intakes. We should have immediate interventions for poor food and fluid intakes. For example, if someone's not drinking, Can we give them a fruit punch they really like or a lemonade they really like and get them to put it in a cup near their bedside so they continue to drink, or a water straw beverage cup? Encourage intakes. Provide high-calorie, high-protein snacks. For example, chocolate milk, great snack, cost-effective, easily available in PCs. And use your RD to see your positive COVID residents. Make sure that our staff in the nursing units knows if someone is positive, that we're monitoring them for weight and intake, and that we address it before they become malnourished. So it's important when you have behavioral patients that are positive COVID clientele to know that they're at risk for weight loss and dehydration. Make sure that you communicate with the dietitian. The RD assesses them. The RD looks at social and medical histories. And many, not all, but I would say 85% of COVID residents have upper respiratory distress, no taste, no smell, no ability to taste food. They almost always lose weight. On the other hand, COVID affects some people in different ways. In certain COVID clientele, it affects the lower GI tract, and they have diarrhea constantly and cannot absorb the food. So that has to be handled in a different way. They may have to be on a soft diet and avoid foods that cause that diarrhea, or they may even have to go on a product like Enlive, a clear liquid diet for several days until the diarrhea subsides. It's important to give people what they want to eat and what they like. So again, you want to look at your labs. If you have a BUN that's 80, that means the person's not getting enough water, most likely. If they have a low pre-albumin, they're at risk for malnutrition, not diagnosed with malnutrition, but at risk. Are we monitoring their needs versus their intakes if they're losing weight? What can we do to make food interesting to get them to eat? We need to address weight loss for COVID patients on the treatment plan. And when you are discharging anybody in your behavioral unit, if they have food deserts or food disparity, it's a good idea to put that in their discharge plan and reach out to community sources such as Meals on Wheels. Here's a sample treatment program for a COVID that's lost a lot of weight. This particular person lost 20 pounds in about 2 weeks. They were at risk due to COVID positive. They had very poor intakes and had a history of weight loss. So our goal was to make 50 to 70% of the diet that we were providing them. Our dietitian was the consultant. We were going to have nursing monitor PO and intakes. We're weighing them weekly, and we're giving them, I believe that it is a vanilla milkshake type product. It's kind of like Carnation Instant Breakfast at this facility. And I believe that they had peanut butter cookies, which are high calorie, high fat, at 3 p.m. every day. Teamwork will make you successful at beating COVID to keep it away from your clients, yourself, your family, and your clientele and patients and staff. I'd like to thank you for attending this webinar, and let us know if you can help if you have questions about how to care for your residents. If you have questions about supplement, food, budget, menus, reach out to Michelle Mabry. And if you need CEU, she would be the one you were communicating with you as well. We'd love to assist you in any way we can. If you're an employee, great. Or if you're a vendor or staff member, great. Or if you're a client or a potential client, let us know. We'd love to partner and help you any way we can. I'd like to thank you for taking the time. Here are the websites that we use to get this data to present to you, and here's my number, and here's our webpage.